Doctors are treating Vice President Kamala Harris with an antiviral drug after she tested positive for COVID-19. The vice president saying she is isolating and grateful to be both vaccinated and boosted. Let's bring in ABC News contributor and chief innovation officer at Boston Children's Hospital, Dr. John Brownstein, to talk more about this. Good to see you, Doc.
Good to see you, too.
All right, so Vice President Harris is exhibiting no symptoms, apparently, now taking Paxlovid. White House COVID response coordinator Dr. Ashish Jha says that recently he spoke a lot about this awareness around this drug and accessibility to it. So what are the actual qualifications for it? What more can you tell us?
Right. So the reason why we're so excited about this particular antiviral is that it reduces the risk of hospitalization and death by 90%. So if you can get treatment in the first 5 days of symptoms, you can dramatically reduce the risk for so many people that are at risk of complications from COVID. So who's actually eligible? Well, it's those that are essentially at risk of severe complications, those with diabetes, cancer, obesity. It's actually a wide range of eligibility requirements. In fact, probably 60% of people in this country are eligible for this drug. The issue has been, of course, supply issues, and the White House announced that it's doubling the number of locations that are going to have this drug. It's also going to be about education, making sure doctors recognize that they can prescribe this drug. Clearly, there's some indications with other drugs that people are taking where they may not be eligible. So there's a lot of education that needs to take place. Plus, we're going to have these test to treat locations, the idea that you can get a test, identify if you're positive, and quickly get access to that drug. So a lot is going to change in the coming weeks, very similar to how the vice president identified she was infected and got this treatment. Many in this country are going to have that same experience going forward.
So then let's just talk about the fact that the vice president is vaccinated and boosted, but cases keep going up. They keep going up here in the nation's capital. They keep going up across the nation. So let's talk about the implications for the rest of us right now.
Right. I mean, this pandemic is definitely not over, and it's being driven now by two sublineages of the BA.2 subvariant. So I know that we've talked so much about variants and new variants that emerge that are ultimately more transmissible. So we're not necessarily in a place where this pandemic is over, but at the same time, we have the tools that we need to keep people out of the hospital. You know, we talked about Paxlovid, clearly being vaccinated and boosted. All these layers of intervention mean that we're in definitely a different place. I wouldn't necessarily say that we're endemic at this point, but absolutely we're in a place where we can catch infection and treat it and deal with it. Of course, we still don't know what the next few months hold and what new variants pop up. But at this exact moment, the cases are going up, but we're still seeing good numbers in terms of hospitalizations and deaths.
All right, well, we are talking about the number two person in charge of the United States right now in the White House having COVID. So what do you think of the current White House COVID protocols, and should they change?
Well, listen, this is the most transmissible variant that we have had. So it's not surprising that we are seeing cases emerge in the White House. The issue is, what can they do when they identify them? Well, they're using testing, they're isolating those who are infected, they're using treatments. So those protocols are essentially working. We have not seen any severe cases occur. So ultimately, I think, of course, the White House is a microcosm of what we might see in the rest of the population. But overall, I think they're doing a great job of being able to handle infections and treating people that are potentially exposed.
All right. Dr. Brownstein, thank you so much. We'll continue to follow it, of course.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.